Hello viewers. How are you? This is Dr. Rishi. Look, I've brought you an important video today. Did you heard? A lot of country in the world, rich people donate machines to hospitals called ventilators. We're talking about that ventilator machine today. What's all this talking about, ventilator? A ventilator is a desktop that helps a character breathe. Ventilators are from time to time known as respirators. The use of this time period stems from respiratory units used in the mid-20th century. In modern-day scientific terminology, ventilators are no longer referred to as respirators. The phrase respirator is now used to describe protecting face masks. A ventilator may additionally be wished for a few hours, weeks, or months. Sometimes it is wished for the rest of a person's life. A ventilator blows oxygen into the lungs and gets rid of carbon dioxide out of the lungs. The ventilator is connected to a respiratory tube at one end. The tube is positioned into the windpipe via the nostril or mouth. Sometimes the tube is positioned via a gap in the neck referred to as a tracheostomy. Okay. When is a ventilator used? A ventilator is used at some stage in and every now and then after surgical procedure when regular anesthesia is given. Anesthesia motives sleep and leisure in the course of surgery. A ventilator helps the individual to proceed to breathe for the duration of surgery. A ventilator can additionally be used if the character has a circumstance that influences ordinary breathing. Common ailments and prerequisites that can have an effect on respiratory encompass the following: pneumonia and different lung infections, amyotrophic lateral sclerosis, ALS, and higher spinal wire injury, stroke or talent injury, drug overdose. Okay, let's get to the next point. What to expect while on a ventilator? Ventilators commonly do not result in pain. The respiration tube in your airway might also result in some discomfort. It additionally impacts your capability to discuss and eat. If your respiratory tube is a trach tube, you can also be in a position to talk. A trach tube is put at once into your windpipe via a gap into the front of your neck. Instead of food, your fitness care crew might also supply you vitamins via a tube inserted into a vein. If you are on a ventilator for a lengthy time, you will in all likelihood get food through an esogastric, or feeding, tube. The tube goes through your nostril or mouth, or without delay into your belly or small gut through a surgically made hole. A ventilator appreciably restricts your endeavor and additionally limits your movement. You can also be capable to sit down up in mattress or in a chair. However, you generally cannot go round much. While you are on a ventilator, your fitness care crew will intently watch you. The group can also encompass doctors, nurses, and respiratory therapists. You may additionally want periodic chest x-rays and blood exams to check the tiers of oxygen and carbon dioxide, blood gases, in your body. These exams assist your fitness care crew locate out how nicely the ventilator is working for you. Based on the take a look at results, they can also alter the ventilator's airflow in different settings as needed. Also, a nurse or respiratory therapist will suction your respiration tube from time to time. This helps cast off mucus from your lungs. Suctioning will reason you to cough, and you might also sense quick of breath for countless seconds. You may additionally get greater oxygen for the duration of suctioning to relieve shortness of breath. Just as there are two sides to everything, this also has negative consequences. One of the most serious and frequent dangers of being on a ventilator is pneumonia. The respiratory tube it truly is put in your airway can enable microorganism to enter your lungs. As a result, you may additionally improve ventilator-associated pneumonia, VAP. The respiratory tube additionally makes it difficult for you to cough. Coughing helps clear your airways of lung irritants that can result in infections. VAP is an important difficulty for humans. The use of ventilators due to the fact they're regularly already very sick. Pneumonia may additionally make it more difficult to deal with their different ailments or conditions. VAP is dealt with antibiotics. You may also want one-of-a-kind antibiotics if the VAP is brought on through microorganisms that are resistant to popular treatment. Another threat of being on a ventilator is a sinus infection. This kind of contamination is greater frequent in human beings who have endotracheal tubes. An endotracheal tube is put into your windpipe via your mouth or nose. Sinus infections are handled with antibiotics. Using a ventilator additionally can put you at chance for different problems, such as pneumothorax. This is a circumstance in which air leaks out of the lungs and into the house between the lungs and the chest wall. This can motivate and shortness of breath, and it might also purpose one or each lungs to collapse. Lung damage. Pushing air into the lungs with 2-ton strain can damage the lungs. Oxygen toxicity. High ranges of oxygen can injure the lungs. These issues may additionally show up due to the fact of the pressured airflow or excessive stages of oxygen from the ventilator. Using a ventilator additionally can put you at chance for blood clots and serious pores and skin infections. These issues have a tendency to appear in humans who have positive illnesses and/or who are restricted to mattress or a wheelchair and need to stay in one role for lengthy periods. Another feasible trouble is injury to the vocal cords from the respiratory tube. If you discover it difficult to talk or breathe after your respiratory tube is removed, let your health practitioner know. The most important thing is what to expect when you are taken off of a ventilator. Weaning is the method of taking you off of a ventilator so that you can begin to breathe on your own. People normally are weaned after they've recovered ample from the hassle that induced them to want the ventilator. Weaning normally starts with a quick trial. You remain linked to the ventilator, however you are given a hazard to breathe on your own. Most humans are in a position to breathe on their very own the first time weaning is tried. Once you can correctly breathe on your own, the ventilator is stopped. If you can't breathe on your very own in the course of the quick trial, weaning will be tried at a later time. If repeated weaning tries over a lengthy time don't work, you can also want to use the ventilator lengthy term. After you are weaned, the respiratory tube is removed. You might also cough whilst this is happening. Your voice may additionally be hoarse for a quick time after the tube is eliminated. So, I hope you guys know something you didn't know in this video. Thank you for watching us.